We're live.
All right, good evening, everyone. This is Dr. Schilling from Secoya Health, bringing you this week's Wednesday Wellness Minutes. And today we're going to be doing a live workup of this young man here, Jeff. He's been kind enough to join us on short notice. He has a history of knee challenges on the right side. And I'll just allow Jeff a couple seconds to say what he's, some important information about how it affected him when it first started and things like that.
Okay, well, it's mostly hockey-related injury. I had surgery because of a torn cartilage many years ago in high school, and just over years, the cartilage is kind of worn away, and it's basically down to bone on bone at this point. And it also affects my geometry in my front hips a little bit. Get a little bit of pain on this side, so been doing some glute exercises to try and correct that. And
Sure.
keep things in line. And
Absolutely.
One of the alternatives down the line might be a knee replacement or partial knee replacement. I want to kind of hold off on that as long as I can.
Yeah, for sure, definitely. And there are a lot of things we can do for that. First of all, what's most important is you have a balanced, stable joint. At some point, if we need to do like regenerative cellular therapy, actually put some growth factors into the joint and allow it to heal itself, we can talk about that a different road. That's also something we do here. But for right now, we're just going to kind of evaluate it so he understands how his, like you mentioned, your geometry's been thrown off. Because a lot of it's, is it typically some people have the position or a movement that bugs it the most. For you, what is that? Is it a position or a movement or both?
I would say probably a movement, and that would be probably walking downstairs.
Okay, so it's the descending part. So when you're on that right leg and you lower down, that's where you feel the most agitation. Is that right?
Yeah. Yep.
Okay. And is it sharp? Is it dull, achy? Does it feel like it's grinding? What does it feel like?
Prior to last April, when I had an injection of Synvisc, it was kind of a sharp pain. Now it's just kind of a dull.
Okay. And what were they hoping that would do for you with the Synvisc?
Just possibly provide a little bit of lubrication to the joint.
Okay, gotcha. It wasn't intended to restore any of the cartilage or anything like that.
No.
They were just hoping to kind of give you some gliding fluid, if you will, grease it up like the Tin Man.
Yep.
Okay, fair enough. All right. What have you done as far as therapies or treatments for it in the past? Like seen in PTs, chiropractors, anybody like muscle therapy, massage therapy, stuff like that?
Pretty much just orthopedics and Synvisc.
Okay.
I've also had one, possibly two cortisone shots.
In the knee?
Yeah.
Okay, fair enough. And are you aware that you definitely don't want to go past 3 of those?
Correct.
In a joint? Okay. Irreparable damage. Yeah, Mayo Clinic's done studies on it, and it's not a good idea to go past 3. So anyway, we can talk about that offline as far as what you could do as prevention and as a restorative for that as well. Because that's what regenerative cellular therapy is. It's really like putting growth factors in there, like putting Miracle Grow in the joint and allowing the joint to start restoring itself. Because your body can help itself, but it just needs a little help.
Mm-hmm.
Okay? All right. So the hip's bugging on the left, so we got a global issue now. It's not just isolated to one, right? It's starting to affect your entire geometry, like you said. So we do different types of evaluation. So what I want to see is just any gross differences in your strength. Does that make sense?
Okay.
So what I'll have you do is raise this up a little bit. And I'll have you lay on your back here, make it a little bit longer for you. Okay.
Head here?
Head here,
Okay.
yep. And you may want to bring that in when we get here. Is that comfortable? You can slide down toward your feet. I can make it longer for you.
Oh,
We don't want anything digging your shoulders or anything. There you go. Okay. So you generally have the knee problem here, but you're having the hip issue on this side. That's accurate?
Correct.
How long has the hip been going on?
Year and a half.
Year and a half, okay. Limiting you as far as your level of activity, and like you said, you haven't been in this. You've been with it in this position longer than a year and a half. Like you used to go through the airports and stuff you mentioned.
That was with the toe, though.
Yeah. Oh, that was the toe. So this hasn't affected you. Like this has been after that.
Yeah.
Okay, gotcha. And that was the right toe.
Mm-hmm.
Okay. Do you have any other issues on the right side of your body?
Past issues.
Okay.
I had a lot of surgeries.
Okay.
Rotator cuff.
Okay.
Thumb.
Okay.
And I guess appendix.
Yep. Okay. So you got all kinds of right-sided stuff.
Yeah.
Okay. Fair enough. So if you followed us at all at this point, you know that we're talking about different sidedness issues, right? In Chinese medicine or even Ayurvedic, which is East Indian, we have different energies on the sides of our bodies. Like you have feminine energy on your left and masculine energy on your right. So it could be masculine conflicts, it could be masculine energies, issues, and stuff like that, where different tissues get different trapped. Like shoulders are inability to get out of the way of someone or some stress, feeling like a failure in some way, shape, or form. Like appendix, that's a whole other story. But knees are inability to move forward, like uncertainty with inability to move forward, right? Big toe is like something you want to kick out of your life, right? So there's always a story behind every joint. It's not enough to say, yeah, I got a bum wing, right? And so we don't have time to go over every single aspect of that, but it's just like planting seeds, right? Now you can think back to say, oh, okay, I wonder what was going on in my life at that time when this happened, okay? Because it doesn't go, haywire. I mean, if you got your arm caught in a tractor and it got ripped off, that kind of thing. Different story, right? But if all of a sudden you're just kind of like, oh, I'm getting this bum shoulder and it's just falling apart, or, my thumb, thumbs are inability to oppose, okay? Inability to oppose. So like opponents, we're the only species on the planet that has this thing. Mm-hmm. We can do this, okay? So opposition of something maybe was too forceful on you, something was too much pressure on you, something you couldn't oppose. It's hard to say, right? Elbows are inability to push back, right? So hips are inability to bear something, unable to bear it, bearing too much stress, okay? So it just depends, okay? So then we could spend hours and hours going through different things. We don't want to talk about that right now. We want to get you some understanding of how we can improve this and probably get rid of this as well. Does that make sense?
I'm all for that.
Okay. So my intuition as a clinician says that this is a long-standing issue, but you're having more of an acute issue that won't go away here either, okay? And one might think that, well, the right knee's been a problem for a long time, so the left hip is probably just a compensation, right? I'm just, I'm changing my gait, and like you said, my geometry's off and stuff like that. So, but we're going to test, okay? And so we're going to test just some basic tests. So what I want you to do, Jeff, is just hold your right leg down against the table, okay? And as I might have expected, you're strong as a beast right there, okay? Now hold your leg out to the side now. Push out to the side, okay? And I'm using my entire body weight to lean against that, and that's plenty strong. So I want you to hold this leg up here, and I want you to push up toward the ceiling, okay? No problems. You didn't feel any weakness there, right? Is that accurate? Okay. Now what I want you to do is push your left leg down into the table, okay? And without much effort, you see how easy it is for me to lift up? And what's popping? Is that your hip? Mm-hmm. Okay. Does that normally do that?
Yeah.
It was like, it's like an old creaky door.
Yeah.
Okay. Now hold your leg out to the side, and don't let me push in, okay? Now how hard are you pushing right now?
Pretty hard.
Okay. Now do you see how easy it is for me to push that? Mm-hmm. Now hold this one out here. Tell me how easy this is. Push out to the side. Okay. Is that effortless for you, for the most part?
I'm very right-handed too.
Okay. All right. Hold this leg here. You're just going to apply pressure to the ceiling. Okay. How hard is that for you to hold?
Is that hard?
Not hard? Not hard. You notice which direction it's going, right?
Yeah.
Okay. Now you're not broken. This is a neurological phenomenon. Your right brain, right motor cortex, is affecting your left side of your body. You been getting any pain in the shoulder at all? Mm-hmm. Okay. So right now your brain is holding your shoulder in like this, and it's twisting your hip out. Okay. So you can fix this stuff pretty easy. Okay. So you can feel like Superman here in a couple seconds. Okay. I'm going to fix that in a second. I want to see what this knee's doing first. Okay. I'm just going to bend this up here, and we're going to hold it at a 90-90. Okay. And I'm just going to apply pressure down, and you're just going to resist that force. Okay. So just hold strong where it is. Okay. So the medial quad, perfectly fine, right? You didn't feel any strain, right? No pain, correct? Okay. So we're going to swing the foot in here, and you can bring it in here, man. You can come on in. So drop the foot down. So I want it at a 90-90. Okay. And just hold here, and just going to push up toward the ceiling. Okay. Now, if I apply pressure to that, do you feel a difference? Like it's cracking and popping,
yeah,
and it's starting to go down. Okay. Did that hurt you anywhere?
No.
Okay. Now swing it out here like this. So is that all the mobility of in your hip? Is that kind of tight?
I can feel it here.
Okay. Yeah, your muscles are kind of cramping. Are they cramping?
A little bit.
Okay.
Yeah.
Okay. So now we want the foot to the outside, and I want you to push your foot toward the ceiling. Okay. And I can stand on that. That's plenty strong. Okay. Now this is new to you, so I don't expect you to feel it. This is what I do all day long for years. So when something engages nice and strong, I can feel it. And when it's not, it's not. Okay? So it's more neurological engagement than it is gross motor strength. Does this make sense? Okay. Have you ever been, we talked about we're not doing any adjusting. I do functional neurology where we do fast stretches on muscles and things like that. Have you ever had that done before?
No.
Okay. Okay. So I'm going to balance your brain here. Is that okay?
Okay.
You're like, I don't know what that means. So just go put those on. Keep your eyes open. They're going to blink at you. Inside left and outside right. Okay? There you go. I'm going to borrow your arm. Just let it dangle nice and loose like a wet piece of noodle. Okay? So, do you have any fingers that are injured
No.
that I need to know about? Okay. So wrist and elbow. Good. Let that relax. And then let your leg relax against my shoulder. I'm just going to rock your hip a little bit. So take a breath in and out. Good. Let it relax. Do you have low back pain?
Very seldom.
Okay. None currently?
Not now.
Okay. So I'm just going to do a quick tug on your leg, okay? There you go. Just a fast stretch, okay? Let this knee bend. There you go. Good. Let that relax. That pain in the knee at all? Okay. Let this relax nice and loose. Okay. Good. Let that relax. Now, I want you to tell me how much effort you have to apply now. So push your leg down on the table. Okay. Hold it down. Good. Now push it out to the side. Now, how much different does that feel to you?
Feels stronger.
Yeah, it is. Okay. Push up. Okay. Now you can actually maintain the motor strength, which is good. So now your brain is being balanced. Okay. So this is all important because if your nervous system's imbalanced, right, too much tone on one side, too much being pulled, it's going to throw off this side. So this side is actually right now contributing to this problem, not vice versa.
Oh.
But now that we've resolved that issue, does that make sense? So push your legs down, okay? And what you notice is it doesn't take me a lot of effort to lift up. If you push your leg down, strong, push your leg down, strong, push them both down. Okay. So that's not very hard for me.
Weird.
Yeah. It's weird.
Well, I mean,
It's neurological, okay? It has nothing to do with your body. How often do you get short of breath?
how short? What do you mean?
Well, do you get easily winded?
No.
Okay. Do you get indigestion, acid reflux kind of thing?
Sometimes, but
Sometimes. Was there a time in your life when you had it consistently? Like there was a year or a time frame that you had a lot of stomach acid issues, like a lot of burning?
I guess I don't recall.
Okay, it may not be. There's some patterns. Some people have it like a certain period of time, then it goes away, and then they get it on and off. Okay, so how often do you get like indigestion after eating?
Not daily.
Not daily. Okay, gotcha.
It depends on what I eat.
Sure. So so some people say, well, it's spicy food that gets me. Is that your kind of thing?
Yeah, sometimes.
Okay. So you're a jock, right? So you'll be able to get this. So I want you to hold these two fingers together and hold them as strong as you can go. Now I want you to take a deep breath in and hold it. Hold strong. No, you got to hold it. Okay. So take
Hold
a deep
the
breath.
breath
Yep.
and this?
Yep. I'm challenging coordination now. Hold strong. Good. Now breathe out. Hold these together. No, you got to breathe all the way out. Now hold them together. Okay. Now do you see how easy that is? Does that seem weird to you?
Weird.
Okay. Hold them together, strong as you can go. You got a monster grip. Take a deep breath in. Hold it. Okay. Now breathe all the way out. Okay. Now hold them together. Okay. You see how much stress that is for you breathing alone?
Yeah.
It's pretty dramatic. Okay. Now it's hard for anyone at home to see that, but would you describe that as your strength just pretty much disappeared?
Yeah.
Okay. And that's not abnormal. That's very common actually, that you hold a lot of tension in your diaphragm. Your diaphragm is a muscle. Do you know what your diaphragm looks like?
Kind of like a.
Yeah. Half an inner tube, right?
Mm-hmm.
That guy. It's underneath your ribs. So for those of you who can't see that at home, I don't know how easy that is to see. It's a muscle, okay? It's a breathing muscle, a really important one. The only thing you can't do today, or can't avoid doing today, is breathing. You stop breathing, guess what happens?
Not around much longer.
Party's over, right?
Yeah.
You can go about 3 minutes without air. So this is called a vibrocussor, okay? It's going to do a little massage, okay? Shouldn't be painful. So I'm going to work along that margin, okay? So the reason I do that is because when those muscles are tight, what they do is they tighten all the hip flexors. And what do the hip flexors connect to?
The knee.
Right, okay? So if you're tense in your abdomen, your midsection, it's going to throw off your lower half and your upper half for that matter, okay? But generally speaking, I'm most concerned about your breathing right now. Does that make sense? Okay, so you're just going to feel that pressure. Is that okay? Okay. So take a deep breath in and out. There we go. How tender is it? Not bad.
Mm-mm.
Good. There may be some points that are more tender than others. Good. So just breathe normal for a second. So I just want to have you primed for success no matter what, okay? Deep breath in and out. Good. And one last one. Good. All right. So do a little bit of work on the stomach. So take a deep breath in and out. Good. Excellent. Okay. All right. I'll use the same thumb so you can feel the difference. Okay. So we're going to go back and do that same test, okay? Hold, yeah, you can hold as many fingers as you want. Give you the mechanical advantage. All right, deep breath in and hold it. Now breathe all the way out. Now, what did you notice different?
Feel stronger.
You can actually hold your hand together now.
Yeah.
Okay, breathing does not throw off your body anymore. It's helpful. Would you agree?
Yeah.
Because the simple act of walking, talking, and breathing should not make your body go weak.
True.
Not just having a conversation, but like when you do athletics, if you were to go skate or something like that. Okay? All right, so now, because we want to make sure that everything's solid, we're going to test a couple more muscles around the knee. So let this leg lay flat. Okay? Well, actually, let's go back. Gesundheit.
Thank you.
Now, Jeff, I want you to push both legs down on the table now. Okay? And what do you notice now?
You can't pull them up.
I can't pull you up. It's pretty helpful, right?
Yeah.
Good. Okay. So what we're going to do is we're going to test the muscles around the knee now. Okay? So we're going to bend this. And we've already tested the different quad muscles, but I want to test the hamstrings. Okay? Do you often get cramping? Muscle cramping?
Not so much.
Okay. How often? Like once a week? Once a month?
Once a month.
Okay. So we're going to turn the knee in. I want you to pull your foot without moving this part of your leg. Just pull your foot down toward this leg. Good? Okay. That's pretty easy. Did you cramp?
A little bit.
So I know a few things about different bodies, and when I find certain patterns, it's common. So I wasn't trying to predict the future, but I had a quick question, right? So bring it back in the middle. Now I want you to push your foot down toward the table. Go ahead. Now, were you cramping in the hamstring or the foot or the calf?
I was in the calf.
Okay, gotcha. So those two are fine. So now we're going to bring it up here a little bit, bring it out to the side, and I want you to push, without moving your knee, I want you to push your foot down toward the table. Go ahead. You got it?
Yep.
So
It's cramping.
in here or back here?
Back here.
Back in the calf? Okay. So that means you're trying to compensate, okay? Because I'm trying to activate your hamstring and you're trying to find a way to do it with your calf, okay? So
Well, you just want me to use this, though, right?
I want you to hold your foot down, okay?
You want me to use my whole leg?
Yeah.
Oh,
Yeah.
okay. I thought it just said,
I'm
just
sorry.
the foot.
No, no, no.
Okay.
So better thing to say is just resist whatever I'm doing, okay? Does that make sense? So let this come up here, bend the knee down. Okay, now bring it out, the foot out to the side. Now I want you to pull your foot down like this. Does that make sense? Okay, go ahead. Okay. Now, this is one of the strongest muscles in your body. Which way is it going?
Up.
Which way should it go?
Down.
Okay, pull up, or pull down, I should say. Pull down. So I'm just leaning into this, and you can see that hamstring is shut off, and you're fighting pretty hard.
Yeah.
Okay, bring it to the middle, and now push down. Go ahead. Okay, now you feel the difference, right?
Mm-hmm.
There's no way I'm moving that. Now, pull it down now. Okay, so distinct difference, right? So I'm testing the different branches of the hamstring just like I tested the different branches of the quad, because actually, for a second, when you boil it down, any joint in your body is just a bunch of bones hanging there. And if you didn't have muscles, what would you be?
A skeleton.
A bag of bones, right? Now, typically, I joke around and say, what do chiropractors do? And people are like, well, they crack you. They snap you, pop you. We say adjust, but whatever. So we come down to the simplest common denominator. We say we move bones, okay? Then I ask you, what else moves bones? Right? Don't think too hard about it.
What else moves?
What else moves bones? What are these things?
Muscles.
Muscles, okay? Who does a better job?
Chiropractors?
Yeah, all right, I'll give you $5 later. No. No, your muscles do. But what tells your muscles what to do?
Your brain.
Exactly. So who's smarter in the end? The person on the outside or the person on the inside?
I guess the person on the inside.
Right. Okay. But sometimes things get gummed up. Like you get too much stress in your right brain, throws off your left side of your body, which gums up the right side of your body. Okay. So it's all about balance, right? So I use kinesiology, this muscle testing system, because your body can tell me what it needs help with, rather than me thinking as a clinician that I'm smarter than your body, that I know what it needs. I know how to work with it once I know, but my job is just simply say, okay, what does it need help with? Does that make sense? I'll take these off because I don't want to overstimulate your right motor. Okay? It's all about balance, right? There's too much of a good thing is a bad thing. Does that make sense? So my job is that what I like to see is, and I don't know if I can make it 100% perfect, is take you out to the stairs after this and have you go down and see how much benefit. Now, he does have significant degeneration in the knee. Now, you showed me an x-ray, a picture of his x-ray on his phone, and this is the outside lateral, this is the medial compartment. So the medial compartment here has eroded down quite significantly. So the femoral head here is going into the tibia. This is the bone down here, the tibia, the shin bone, and then this is the femur up here. So there's significant changes there. But hopefully we can get him a significant level of relief, shall we say. Does that make sense? Okay. Now, another way we can test is, because you have one branch of that hamstring that's tight, I want to see if there's anything else. So push your leg down on the table and hold it. 5, 4, 3, 2, 1. Relax it. Now push down again. Okay? Now look what happens. Okay? You go from beast mode to, I joke around like weak as a kitten, right? Strong as an ox, weak as a kitten. Yeah, here you go. Now push this leg down. Good. Now relax it. Now push it down. You notice what happens there. No change, right? That means this side's okay. You got some extra tension over here. This one seems balanced, okay? Now, because we worked on your diaphragm has a connection to your psoas muscle. You don't know any of this, I suppose. Your psoas is a muscle. You grab the model in the other room. There's a There's a muscle in the front of your spine which does a lot of this, okay? It's a major hip flexor. When people do sit-ups, they're not really using their abs, more than about this. After that, it's your hip flexor that pulls you up, okay? Generally speaking, don't ever do a sit-up, because sit-ups, the military's even banned them finally.
Really?
Yep. So here's a model of the spine. What I'm talking about is this big fleshy thing right here, okay? It's called the psoas muscle. So if you stood it next to me, it's a muscle that attaches to your lumbar, your low back spine, okay? And comes down through your hip and attaches the inside of your leg. So it does this with your leg, okay? And it does a little bit of this. Your quad does it as well. But your diaphragm attaches right about in here, okay? And it tenses this guy when it's tight. So they work in unison, okay? So just give you an idea of what we're talking about. Because otherwise it's just like a bunch of words you're like, I don't understand what that means.
So my diaphragm is the cause a lot of this?
That has been contributing.
Really?
No, my joke around here, everybody giggles when I say it, is no one thing causes any one thing. It's a system, and your body is a master adapter. So what happens is it starts adapting to different things. Like you tweak the knee and your body's like, oh, that's not working real well, so we're going to tweak this. And you become like, Jenga.
Yeah.
And you're now walking, sideways, or however you have to do to adapt. Even when you were playing like in college, you were still trying to figure out a way to adapt to that knee after you had the scope, right? Like you said, they were in vogue when you were in high school. And you're like, oh, don't worry, Jeff, we'll go in there, we'll scope it, you'll be fine. But forgetting about the fact that I've just taken something out of the picture, what's the body going to do as a result? Right? In hindsight, they didn't know.
Right.
Okay? So my goal for you would be to maintain every original equipment manufacturing part you have. Okay? So your bones, not, because what is a knee replacement, right? They lop off part of your femur, they lop off part of your tibia, and they put metal in there. Now you got a bionic knee, right? Does that make sense? Okay. So we got a lot of good information here. I want you to bend your knee up here, and I want you to set your heel down and raise your foot up and then hold it in here. So I want you to pull your toe up to that corner, okay? Yeah, so up that way. There you go. Yep. And hold it there. Don't let me push, okay? So I'm not applying a lot of pressure. You can hear in my voice I'm not straining very much. But which direction is your foot going?
Down.
Okay. Now let's just try the other foot. This is a big problem for a lot of knees, okay? Oops, sorry. You're good. If you cramp, let me know, okay? So pull your foot up in that corner now. And don't let me push, okay? How does that feel by comparison?
Stronger.
That's stronger, right? So we have a muscle on the back of the knee here. I don't know how tender it is, okay?
Sometimes if I do a long walk, I can feel it.
It kind of aches on you?
Yep.
Okay. Because that muscle is called the key that unlocks the knee. So your femur, which is this bone, your tibia, they sit like this. In order to bend your knee, you have to turn it a little bit and unlock like that. Okay, that's how the mechanics work. Popliteus, the job of popliteus is to do that, unlock. Turns and unlocks, okay? So that guy is pretty much a symptom of now tell me how much tenderness you have along here. None, okay. Down the calf, nothing. Outside of the foot, okay. So we're just looking for a pattern here. So hold your foot out to the side, just hold it right there, don't let me push. That works fine, pull your toe up to that corner. Good. Now pull your toe up in that corner. See, when your knee is straight, look what happens. Pull it up in that corner. No, just hold it up there. Don't let me pull. See how it doesn't change? But as soon as you activate the knee, now pull it up in that corner and watch what happens. It's like magic. Okay? So we're changing a system. We're adding a variable. Okay? Now hold your foot right there. Don't let me move it, okay? Just push straight across toward the window. Okay? That works pretty good. Okay? Very rare that anybody has feet that work that well. So you got that going for you. Okay? Hold your foot there. Push straight toward the wall. Good. Pull up toward that corner. Pull up toward that corner. And drop down and push out at that corner. Now that doesn't work so well. Try that again. You see how that doesn't work so well? I don't know how much you feel like that. You can't see it, but
Easier to push.
yeah, it's just moving straight across, okay? And you usually have popcorn toes? Your feet pop a lot? No.
Not really.
Okay, all right. How much tenderness do you have on this side of your leg? Outside, okay. Cross here?
Little there.
Okay, a little bit of cross there?
Yeah.
Okay, all right. So when I see popliteus show up and I see a lateral leg muscle show up, I'm thinking most likely right over in this area. We call this a 3M point. Did you know that?
No.
And nobody inside 3M knows that. We in the functional medicine world in Minnesota and western Wisconsin call this the Minnesota point, 3M point, because it's related to phthalates and other xenoestrogens and things like that that are commonly found in chemicals. So hold your fingers there. This is called a reflex test, okay? I want you to hold your foot out to the side. Don't pull it that way, just push out to the side.
Push.
Okay, yep. Now, I don't know, what did you feel there? I'm just looking for your perception.
I guess I didn't really notice
Okay,
anything.
all right, hold your foot up in that corner now. Nice and strong. What do you notice there?
Up here?
Down here.
Oh.
Hold. No, I can't move your foot.
Okay.
Well, take your hand off. That's just how I do, like, it's a diagnostic test. It's a differential diagnosis. Hold your foot up there, and look what happens. I'm not applying a lot of pressure, and it's going the wrong direction, okay? So, you're a pretty smart guy. Do you think this and this are connected?
I would think so.
Yeah, logic entails, right? But at the first rush, you're like, I guess so.
Yeah.
But if we weren't putting pressure on here, and this didn't work, or it did work, we wouldn't worry about it. But if something doesn't work, every part of your body should work just fine. Does that make sense?
Mm-hmm.
Okay. So what we need to do is check your psoas right now, because those muscles. We also need to fix your hamstring, fix your popliteus, and your quad, okay? And it was on the inside, so you got a lateral quad issue, I don't know, somewhere in your vastus lateralis. Is that tender?
That kind of tickled.
Okay, you winced a little bit. What about this side? Are you ticklish in general?
Yeah.
Okay, that's fine. I'm going to torture you.
No.
What's interesting,
Get coming with the feather.
like out of a cartoon or something. What you want to appreciate in your brain perceives all signals from the body. So what happens is pain and tickle are the same thing. So you ever had somebody tickle you so bad, it hurt so bad, but you couldn't stop laughing?
Yeah.
Okay. Your brain does not know the difference between tickle and pain. So your brain is perceiving this as pain, even though you're ticklish. Does that make sense? Follow me with that logic? Okay, fair enough. So let's test your left psoas first, okay? That entails bringing this leg up and out like this, and you're going to push up toward the ceiling, okay? Yep, just like that. So I'm going to press 1, 2, 3, 4, 5. You're going to relax a second, now push up again. And that side works fine. Even though you're holding your breath, I normally tell people to breathe anyway, but
Sorry.
no, you're fine. You didn't break it. Trust
Just
me.
trying to,
You're just concentrating.
focus.
That's okay. Turn the leg out, and you're going to push up toward the ceiling now. Got it? And what you notice is, how well is that working?
Not so well.
Not so well. Okay? Opportunity for improvement, right? Nothing is a problem. It's an opportunity for improvement. So, you can tell me just how tender this is right here. Is that sore at all? Oh, fantastic. Okay. So this is where we're going to stimulate your psoas. Remember, that comes across the front of the body and it goes down into your hip. So this muscle is affecting your hip, which is affecting your knee. Follow me so far? Okay. So what we're going to do is we're going to bend your knee. There you go. Good. You're just going to let the ankle rest right there. Good. So your job is to, actually no, we're going to do a different one. We're going to start up here, okay? And we're just going to push your leg down and away. So show me how you're going to do that.
That way?
Down and away, this way.
Oh.
Yep, down and away. Just like that, okay? 3 of them, okay? Take a deep breath in. Exhale, push down and away. Good. And deep breath. Exhale. Good. And one more time. Now we're going to bring it back up here. You're going to turn the foot out. You're going to push up toward the ceiling. Okay, go ahead. How strong does that feel?
It just feels awkward.
Okay,
So,
it's a positional thing.
yeah.
Okay, but just hold, push and hold.
Okay.
Okay, just push and hold. Does that feel weak at all to you?
Not really.
Aside from the awkward position?
Yeah.
Okay, so it's strong now. It's perfectly fine. Again, this is important. And I'm going to see in a second how that's affecting your hamstring and how that's affecting your quad. Okay, because that can throw those off. Okay,
I'm sure.
we're going to bring these.
It's probably off, too.
Okay, we're going to push up to the ceiling now. Good, and push up again. Up one time. Good, it works just fine. Left side, not a problem. So what we're going to do, bend the knee. We're going to bring it out to the side. Now I want you to, remember this time, you're going to push your foot straight down toward the table. Okay, go ahead.
With the entire leg.
You're going to keep this knee like this. You're going to push this part of your leg down like that. Okay, go ahead. Okay, now what you notice is, I can't change that. Okay, before, where was it going? Up toward the ceiling. That's a good sign. Would you agree?
Yeah.
So now we're going to bring it in here, and this is where your knee was going, like you know the old car door.
Yep.
Okay, so keeping it about 90-90. Yeah. I want you to push up toward the ceiling now. Okay. Now it's still popping, but the strength is there.
Okay.
It's not going any direction. So the moral of this story, so you're kind of looking for the punchline, resolve the stress up here, balance and strengthen the muscle here, which balances the hips, and now the knee is balanced because you're looking at all the muscles around it. Okay. I don't know if it's going to resolve the popliteus, but we'll check. Okay. So hold your foot up in that corner again. Okay. Don't let me push. Now you notice what's strong?
What?
Pretty cool. 3 birds with 1 stone. Fix that one, the other 3 fix these up. Whereas someone else might say, oh yeah, you got that week and that week and that week, we're going to treat them all. Okay? So what usually gets the grease?
Squeaky wheel.
There you go, right? Well, this may be squeaky. It's probably not the biggest problem. Okay? That makes sense?
Okay.
You can't right now like snap your finger and reverse the degeneration.
Correct.
Okay? But you can have big changes. Okay? When you do lunges at all?
No.
Okay. Do they because they give you grief, or just because you just don't do them?
I just don't do it.
Okay, fine. So some people just don't do them because it just doesn't feel right.
I just don't, I think it would be stressful on the knee if I did it.
Okay. Okay, so you avoid it.
Yeah.
Okay, so this is one of the things that's limiting his quality of life because it's taken away from your enjoyment. Like you could, not that you want to do a bunch of lunges, but you could, hey, I'm gonna do some lunges, right? Because it's a good movement, right? It involves flexibility and strength and things like that. But you don't do it because you're worried it's hurting the knee, right? Most people don't breathe when they do lunges. Okay, so they lunge down, they're like, they hold their breath the whole time, which is a horrible idea. Okay, because your hip flexors are tied to your diaphragm through your psoas. So you need to breathe. Up and back, okay, the whole time. Breathe in and out, okay? When you walk upstairs, do you tend to hold your breath?
I don't think so.
No, you don't. You probably never pay attention to it. But like these stairs out here, your best bet, there's probably 20 stairs, maybe not that many. Take a breath in at the bottom, or even take a breath in as you walk up, and then exhale, like breath in for half of it, exhale for the other half. Most people are like, they either think they have to breathe more or they don't breathe at all, one of the two. Okay, so just pay attention next time you go upstairs. Like, I wonder how I'm breathing. It's all about observing. It's all about learning about your body because this will empower you to know more about your body. Does that make sense? Okay. So we fixed the popliteus. That ankle is fine. The hamstring resolved. The quad resolved, which is awesome, by fixing the psoas and the diaphragm. We like that, okay? I'm just going to test your core, okay? So I want you to bring both feet together, okay? Both feet pointing up. Bring your legs over here. You can hold on to the side of the table. This isn't a test where I'm trying to win. This is a test just to see what works. So you're just going to hold on to that for confidence so you feel like you're stable, okay? And push your legs that way, okay? Okay, that works fine. Now take this foot, open. This one stays up. And push your legs that way. Nope, sorry.
Sorry, I was going the wrong.
It's okay. Hold that way. All right. Now you notice the difference.
Yeah.
How hard are you fighting?
Pretty hard.
Pretty hard, okay. Bring both feet straight up. Bring them over here. Push that way. How hard are you fighting?
Hard.
Yeah, but you're staying.
Yeah.
It's not going, whoop, not like a revolving door, okay? We don't have to get too personal, but just on a grade of A, B, C, D, or F, what would you give your digestion in general?
I would say probably a B plus.
B plus, okay, so pretty good. Not an A plus, but a B plus. Okay,
Yeah,
all right.
Yeah.
Okay, sweet. So your belly button is typically right about here. If you just take 2 fingers on your right hand and just put them right in here, okay? Just press, right in the middle, right in the midline, right by your button. That's a small intestine reflex point. Just gonna bring your feet up, bring that leg out, and then bring your legs over here. Now I want you to push that way, okay? So that's not it, okay? That's just a quick check.
Feeling awkward.
Yeah, it didn't change. So let's just go up here to this guy here. Is that tender or ticklish?
Mhm.
Okay, let me find a point where, like that guy right there. Is that tender or ticklish?
Not really.
Okay. Bring that foot out, bring this foot up, bring your legs over, push that way. Okay? What do you notice that?
It's hard.
It's holding strong?
I don't know. It's just an awkward movement.
Okay,
Never
fair
had
enough.
to do it before.
Well, right. It's new to you, okay?
Yeah.
I'm just testing to see, like, what's going on the inside and how is it reflecting to the outside. Does that make sense?
Mm-hmm.
You don't need to know everything I'm doing because that's not your job. You're just like, just fix it, dude. So pretty much people come here, just fix it, right? I want you to understand how your body's working. Does that make sense?
Well, plus we're doing it live. You need to.
Well, sure.
educate.
No, right. Education is helpful. But do you know what the definition of a doctor is? Not a trick question. Just curious if you know. People are like, well, somebody goes to medical school, right?
Someone who fixes it, who helps people.
Right. Well, it actually means teacher. So if whoever you work with, if they don't teach you how to help yourself, if they can't give you skills and help you understand your body and be empowered in the future, then they're not really doing their job. Doesn't matter what initial they have after their name.
Right.
MD, DC, DO, ND, blah, 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 blah. They need to teach you. That's what the word doctor means in Latin. Teacher, doctor, teacher, okay? So just so you know. So next time someone says, here's some information, say, that's great. How can I help myself? Don't just give me some idea like, right? So I'm trying to help you understand your body so you understand the interconnectedness. Does that make sense? Okay. Fantastic.
Amazing. I've never had anyone go in this much depth before.
Well, it's important that you understand it, right? And I don't usually have this much time with people, but we're taking the luxury of giving you this information. I usually drip it on people a little bit here and there. I usually talk way too fast and give way too much information in a very short period of time. Because I want you to have, like, okay, now I understand my body. Like, this is your body to work for, it's supposed to work for you and not against you. Up until now, you've got the appendix that went sideways, you got the thumb, the shoulder, the knee, right? And the toe. I mean, you're just batting 1,000. You almost have every single joint, with the exception of the elbow and that hip.
Oh, and I had thumb surgery
Yeah,
as a kid.
there you go.
So
That's impressive. Right?
I tell people about my surgeries, and they say, wow, you got a lot of surgeries.
Yeah,
I mean, I guess I have.
yeah, that's fascinating. The wing doesn't give you any more grief? Sweet. Did they just, was it a tear or was it?
Yeah, it was a tear.
Okay.
And it kind of came off, and
Okay.
there were some bone spurs in there too.
Okay.
Probably
Did they,
from hockey.
they went in the Dremel in there and zzz, took them down? Cool. All right. So I'm curious at this point. I'm going to have you just stand up on the side of the table there, kind of facing the camera. And I suspect putting your right foot forward in this position in the past, you would have not given you a lot of confidence. You can lean on the table. I want you to feel confident. So when you lean forward, how much strain does that cause? Make sure you're breathing now. You don't want you to hold your breath because you're thinking like, what
Well,
is
the
it?
first time I went down, it kind of popped a little bit.
Okay.
It's better now, though.
Okay. Very good.
Popping.
Gotcha. All right. What other movement besides going down the stairs might give you a problem? Is like putting your shoes on like this? Is it like if you lean down the wrong way?
sometimes like tying shoes.
Okay.
I mean, but more on this side than this side.
Okay. So that position would be what? Like this? Like lifting your leg up would be a problem?
Yeah, or bending over.
Okay. So that, do you usually feel it back here or is it in the hip?
Pretty much here.
You feel it in the side when you're going down like that? Okay. And is it dull and achy? Is it pressure? Does it feel stabbing and sharp?
It's just kind of dull and aching and kind of like pulling.
Okay. Do you get IT band issues? Like knee pain, IT band, tension down that hip?
Yeah, I mean,
Okay. All right, just quickly on your stomach. Just curious about something here. Just give me the full work over here. All right. Keep this leg straight, Jeff. I want you to raise it up in the air and then out to the side. And hold it right there and don't let me push. How strong do you feel right now?
semi-strong.
Okay. Raise this one up and out. And hold it right there. Don't let me push. Okay. How does that feel?
Stronger.
Stronger, right? So you thought this guy was your bad guy, right?
Yeah.
You don't have any bad parts. Let's put it that way. Okay, I'm going to slide this under your hip. Okay, just let that relax. Now raise this up and out. and hold it there. What does that feel like now?
Stronger.
Stronger. Nice, right? Do you like to be strong or weak, Jeff?
Strong.
Okay, I figured as much. I know. I'm Captain.
Not a rhetorical question.
I'm Captain Obvious. Have we met?
Yeah.
Okay. Bring your knee out to the side, and just hold your leg. Hold this leg down against this leg. Okay. Don't let me move it. I don't know if you can see that, but how well is that working for you?
That's good.
Is it cramping?
Up too.
In here?
Yeah.
Okay. All right. Bring your leg back up here. Let's just test it against this one. Hold this down against that leg. How does that feel?
Stronger.
Stronger. Nice. Okay. Would you like to be equal on both sides?
I'd like to have strength on both sides.
Okay. So bring this here, drop it down. You're going to start here. You're going to push out to the side, like that.
Okay.
Okay. So take a deep breath in, exhale, and push. Good. And again. Good. And one more time. Good. Take that away. Now bend this guy, bring it down, and hold it down here. Got it? One more time. You cramping again? Okay, hold it down. Does that feel strong?
Yeah.
Okay. Raise that leg up and out. Yep, and hold out there. Nice and strong, don't let me push. How strong does that feel?
Stronger.
Feel stronger, right? Okay. Go ahead and pop up again. And face the same direction you were going to sit over there. So sit up. Sorry, not giving you very good instructions here. Sit and face that way like you were a second ago, because I want you to see if anything has changed.
Okay.
Okay. And so kind of lean down like you're going to tie your shoe again. Tell me if anything feels different.
Feels about the same.
Okay, fair enough. So there's obviously something out there. I have a strong suspicion that you have some congestion in this organ over here, which is affecting the muscles on the sides of your legs, which is partly affecting that knee as well. But we don't have time to go into all that tonight. So let's see. Why don't you, I don't know the range of the camera, but take a walk with me. I know she can't go with me.
I'll do my best.
Yeah, well, you're not going to go very far. I think it's got a short leash on it. So we'll just walk down here. I'm just curious as to see how you feel on the stairs. I don't expect perfection, but I want to see general sense. Make sure you're breathing.
That direction. Oh, jeez. Taking it off the tripod. Okay. I ended up following you.
Okay, connected. Gotcha. All right. Come on back in. I know, move the tripod there.
For sure.
Behind the scenes look at our smooth operation here.
Super smooth.
All right, here we go. Put that back in there. Got it?
Yeah.
Anyway, okay. So what do you have to see here? I'll plug that thing back in.
Yes. I need to stabilize the inexpensive phone first.
It's only a 10. Now, at this point, they accept and whatever else.
That's true.
Okay, so I threw a lot at you. I don't expect you to retain much. What questions do you have based on what we just walked over and walked through and talked about?
Well, I guess a question what I have is what is some things that I could do at home to maintain
For sure.
and keep
Yep.
so I don't have the pain.
Right, for sure. So we always recommend doing things as long as there's no pain. If it's soreness or achiness, you can try to work through that. Okay? Don't ever work through pain. That's never a good idea for anybody, just so you know, as a frame of reference. So if, that's achy going on tying your shoe, I wouldn't say stop doing that. Do you have a foam roller at home at all?
I do.
Okay. Foam rollers are great. They work up the myofascial tissue and they loosen up. You ever cut up a chicken before? Mm-hmm. So, if you take the breast off and there's usually the white, really tough texture on that, that's called the fascia. That allows the muscles to slide against each other. When you do foam rolling, that breaks up let's say I'm sliding my shirt up and down like this, and I stick my finger here and I try to slide, it doesn't go very well. That's like an adhesion. That's an example. So when you have adhesions, your muscles don't slide very well. Okay, so when you try to move, they can get stuck, things like that. Okay, there's a lot of other reasons why, but foam rolling before doing exercise is absolutely brilliant. It's really helpful. Don't do any static stretching. Don't try to hold your hamstring for 30 seconds and then go try to jog or play hockey or anything like that. That's a recipe for disaster because you're taking a cold muscle and you're statically stretching it and trying to increase the length, you're going to tear muscle fibers, which is going to predispose you for injury. Does that make sense?
Mm-hmm.
Okay. I would encourage you to start paying attention to your breath, okay? Because when you stop breathing, you constrict everything.
You kind of tense up.
Tense up, exactly. Everything gets tense. That can be while you're exercising and while you're not. And just paying attention, be mindful of your breath, okay? Doing lunges would be beneficial for you because you're going to increase the mobility of that knee, but you're also going to increase and challenge those hip flexors, okay? So that can be something as simple as, you know, stepping forward, down like this, and back, okay? And doing that one on each side, and back and forth, but breathing the whole time. Another way to do it is, let's say you had the weak psoas on this side, you set your knee on the ground, okay? And then you let your hips dip into that, okay? Now, we can learn some other things later on about how to change the fascia and how to strengthen it and stuff like that. I can teach you that later. But doing those exercises and pumping up and down like this, like you're, Pinocchio and Geppetto were, okay, they have the strings. So imagine
I'm a real boy.
Yeah, I'm a real boy. You want to come up and straight up and down, okay? And that's going to strengthen your hips, okay? Does that make sense?
Yeah.
Paying attention to how well, like you can challenge your knee in different positions, right? For you going up and down stairs, taking 5 seconds to go up a stair or down a stair. Will you grab the step stool, the one we use in the back, please? It's really helpful to, this is great, you're not an elderly person, you're a young guy. But for elderly people, what they don't do is they tend to do this with their movements. They tend to fall into chairs and stuff like that. Or they tend to, like this, and push up, okay? Mm-hmm. So one thing you can do for knees, which is great, I don't know if you can see this, but, obviously do this on both sides, but you want to take a breath in and slowly up and then slowly back down, okay? And the slower you can do it, the more muscle fibers you're going to train in the intermediate, because most people are going to be like, yep, here we go, I'm going up. That's their exercise, right?
Get it over with.
Exactly. I just got to do 25 step-ups and I'll be done. Oh, thank goodness. 25 seconds of rest and on the next one. But it's really about, if you want to strengthen, you want to really strengthen that joint, you go up slow and down. But the key is to breathe the whole time. Because if you stop breathing, tightens up all this stuff, messes up your whole chain. It's called a kinetic chain. Does that make sense?
Yeah.
If I knew more about you, I'd know more about like the insides versus the outsides. I could give you more like lifestyle stuff like that. But do you get affected by if you eat too many cashews or walnuts, or if you eat too rich a food, like too greasy or anything like that? Does that affect you?
Yeah, sometimes.
Okay, so that's going to be a key indication for you, and that's going to contribute to that pain in your hip. Okay, so the 3M point is right on what's called the gallbladder meridian. So the pain you describe in your left hip is pretty much right across your hip, okay, when you lean down. Well, the organ sits right about here, but the meridian runs from the outside of your foot up, and popliteus connects to this line, okay, the one behind your knee, which you said aches after you walk. Goes up the leg, goes across the hip, across the abdomen, basically up here, then it goes between the shoulder blades, and as you can see here, goes up the neck. So a lot of people's headaches are a result of this. Okay, I don't know if you're a headache guy or not, but ultimately you want to understand that the gallbladder receives all its contents from the liver. So if you have gallbladder issues and you haven't been kicked by a mule or hit by a hockey puck, right? Ultimately,
Not lately.
Yep, not lately. Ultimately, you probably have some liver stress as a general rule of thumb. Not a guarantee, but it's a general rule of thumb. Okay? So paying attention to how you feel after you've eaten something, that makes sense? We can talk later on about food combining, whether you're combining carbs, fats, and proteins at the same time, or if you're splitting them up and stuff like that. That can be beneficial for some people. Okay? But slow movements, especially for someone who has a history of an instability in the joint, while you may have some joint, so we talked about in the x-ray, if you have a nice gap there, yours is pretty much down like this. The outside, the lateral compartment out here is pretty good. This inside one is pretty much, like you said, bone on bone. And it looks pretty significant. Mm-hmm. So I don't know what prevention can be done now as far as that, but having a stable system here is really important. And how to breathe and how to move your body and making sure everything's balanced is really key to having that stay your knee and not become, Lee Majors, the $6 million man, the Bionic Man. I don't know if he had bionic parts, but anyway, you get the idea.
Right.
But there are simple things you can do for this. Whether that is ever going to be fully returned to its normal joint space, that might be impossible. I don't know. I think your body's capable of amazing things. You just don't know at this point.
Right.
Okay. So yes, we can give you some information about different times to eat things that will help you benefit your hormonal cycles, and it will help you determine what foods are going to fuel your body better, and then you can take that in consideration. What other questions do you have? Probably come up with 100 of them after you walk out of here.
Yeah,
but-
no, nothing really. I mean, it was more just in the past, just kind of, well, okay, you've got, bone on bone.
Sure.
We're going to inject, and then you've got a little hip problem, so we're going to get you just some PT with glute. And it was
Sure. Yeah.
kind of a, I guess, for lack of a better word, Band-Aid.
Sure. Yeah.
And
You can do a lot of good things by balancing your core. There's like Posture Restoration Institute is a really good program. Some PTs do it. I know Liz DeJong, I think she married, I don't remember her last name, but she's up in Stillwater. She's posture restoration certified, and people who have really wonky pelvises and women with dropped pelvic floors and stuff like that is really great for. I mean, anybody can benefit from it, there's no doubt. Because pelvic and core stability is critical, right? I mean, everything below it and everything above it depends on it.
yeah.
So keep up that work. Do your glute raises, your bridging and stuff like that. If they had you doing that, it's really powerful. Do you know any bridging? Where you like lay on your back and you push your hips towards the
Yeah.
ceiling? Okay. That's going to activate your glutes. Glutes are the strongest muscles in your body. Okay? As far as,
Well, they gave me a whole slew of glute muscle or glute exercises to do. Should I work in some of those?
wouldn't hurt. Wouldn't hurt. I mean, if anything causes you pain, obviously, hold back and say what's going on there. Because pain's an indicator. Pain's like the last thing to show up and the first thing to go away. So it's not a really good indicator. But if it happens, don't do that. Right?
Yeah, they were showing me to do I think they call it like a figure 4 where you,
Yeah, cross your leg over.
push, and it would help.
Yeah, it's strength counter strength kind of thing.
Yeah.
That's what it's called. Yeah, for sure. Okay. But yeah, basically, degeneration is degeneration. Some of it can be reversed through regenerative cellular therapy, like using amniotic fluid and umbilical cord stem cells and stuff like that. You can reverse a lot of that. Will it ever be 100%? Doubtful, given the level of degeneration, but should be able to maintain your knee for the rest of your life. Should be able to.
Well, that's a better alternative than
Yeah.
a knee replacement.
Right, yeah, because there's a lot of information to say you want to keep your knee, right? Your cognition declines dramatically within 5 years of getting a knee replacement because you basically disconnect your body. Your feet are one of the most important feedbacks to your brain. People don't understand that, but so when you change that dynamic, it changes how your brain functions. It's pretty phenomenal, the statistics.
Really?
Yeah. So yeah, keep your parts. They're important. You were born with them, you want to keep them. Okay?
Okay.
But yeah, so I don't think this should not plague you. Okay, there's a couple more tweaks that need to be done. As far as obviously you felt some improvement. I don't know how much was captured on the camera, but you did feel better than when you came in. And like I said, I don't expect to be perfect, but I expect that you now have a better understanding of your body, and you know some things to do differently, as well as you know that there's also hope, right? That you haven't lost it all, and you're like, I just got to walk around babying this thing because hope it doesn't, fall apart on me anymore.
Right.
Right? Does that make sense?
And as far as exercises at home, what do you recommend it? Like every other day, every day?
I don't think you necessarily need to do one thing like over and over and over. Like I need to do my glute exercise every day. I think it'd be a good idea to move your body around. I do personally all body weight exercises. I don't do weights and machines and stuff like that. I did a lot of that in college, but I don't do that anymore because I find that I feel actual true human strength by doing body weight exercises. If that makes sense.
We do push-ups at work.
Okay. It's good.
Yes, sir.
Do some wall sits. Okay, wall sits. What's it? You probably don't have a pull-up bar there, so you probably can't do that.
No.
What's another good one? Push-ups are great. We already spend so much time down like this, though, that if you're going to do something to get your blood flowing, I'm sure you got a wall at work, right? Sit on that sucker, get your legs at 90-90, and just let it burn, because these things will start burning on you. But you got to make sure you got to squeeze your glutes. It feels like you're pushing up from the floor. Most people just put all their weight on their glutes, on their quads here. Then your knees start aching. Mm-hmm. And what you don't want to do is have your knees back like that. Don't do that. Make sure you're at 90-90. okay? But make sure you're firing the most powerful muscle in your body. Yeah, give her a shot. Give yourself a good enough space there. There you go. Yep. Good. Now bring those knees out a little bit, your feet out a little bit further. Yep, there you go. Good. That's a good position. You can see, I don't know if you can see, but his knees at 90-90. This will definitely challenge you. But the key here is to keep breathing, okay? Yeah. So as soon as I take my eye off him, he stops breathing, okay? So you want to make sure you're nice and squat there. And great thing we did, was it 2 years ago, 3 years ago? At Super Bowl, every time they had a timeout or something, there was like a challenge. We did either push-ups, wall squat. Yeah, it just burns, doesn't it?
Yeah.
Yeah, so making sure you breathe, okay?
Didn't know you need a workout, huh?
Yeah, he's like, all right, I'm done. Time out, tap out. All right, yeah. So you're not weak, but you will notice you've been deconditioned, okay? You just haven't been as active as you used to be.
Right.
Mostly because you're just afraid of making it worse, probably.
Yeah, well, and I'm, not a spring chicken anymore.
Don't go there. Up here is what matters. You start talking about your chronological age, I'm not a spring chicken, and guess where your mind goes?
Same.
Down there. So be mindful what you think, because your attitude determines your altitude, right? I think Zig Ziglar said that. I don't know. But yeah, you're in sales. All the jargon, right?
Right.
Anyway, so yeah, I really appreciate you coming in.
Hey, thank you.
I trust this has been helpful.
Yes.
I know you're physically better because of it. I know they're more empowered and understanding of their bodies as a result of you helping us out. So we appreciate the opportunity.
Well, thanks for letting me come.
Absolutely. All right, guys. Appreciate you joining us this evening. Many thanks to Jeff here for joining us. We'll be trying to do more of these, the Show Me Do is what they're called. Show Me Do, Watch Me Do videos, where you get to see what it's like to understand someone else's body, and then you can apply it to yours. Okay? So we'll see you next week for the Wednesday Wellness Minutes.